So today we are going to go over chapter 3, which is medications used in intravenous preparations. So in this presentation, we are going to be going over the following objectives, and at the end of this presentation, everyone should be familiar with how to discuss the 4 processes of pharmacokinetics that parenteral medications go through. You should be able to discuss factors that must be considered when determining the correct dosages for parenteral medications, including why pediatric and elderly patients require special dosing considerations. You should also be able to name at least 2 references to use to find the storage requirements for a parenteral medication. So now that we've gone over the objectives based on the chapter, we are going to get into an introduction. So in today's presentation, as we continue to learn more about medications that's used in IV prep, is some important things that need to be known. One of the main things that need to be known is how technicians prepare the IV mixtures, and this can be used using aseptic techniques such as garbing and aseptic hand washing, making sure that the technician knows the correct fluid to use, also knowing how a person would react and having knowledge of the IV medication that's being selected. So continuing understanding about the medications that's used in the IV prep, it's important that the technicians must know the medication properties, the interactions, and the side effects of the medications, and also the special considerations. So some special considerations would be pediatric and elderly patients because they require special dosing. And so we'll be able to get into that as we complete the chapter. So one thing to pay attention to when it comes to uh, the medications that's being given to the patients is understanding the pharmacokinetics. So what is pharmacokinetics? Pharmacokinetics is the process that the drug goes through in the body. And there are 4 processes of pharmacokinetics that parenteral medications go through. Those processes are absorption, distribution, metabolism, and excretion. It's important to know there is an acronym that is associated with pharmacokinetics, and that acronym is ADME, A-D-M-E. Absorption has to do with how the medication is going to get in. Distribution is based on where is the medication going. Metabolism is based on how the medication is broken down, and then excretion is based on how the medication is going to leave. So now that we've gone over the definition of pharmacokinetics and learning those 4 processes, let's dive into what the processes mean individually. So absorption is the movement of the drug through barriers to the bloodstream. So pictured here gives you an example of how a medication is provided. This is giving you the picture of if a person was taking this through the GI system, GI standing for gastrointestinal, but when it comes to parenteral, medications that's administered parenterally automatically go to the bloodstream. So the medicine is going to uh, bypass the digestive process that way that it has no barriers. Because if you ingest the medicine, it has to go through the GI tract in order to start working. So with medications being given parenterally, it's going to automatically go to the bloodstream, therefore bypassing the digestive process. So now that I've given you an example of absorption, let's next learn more about distribution. So distribution allows the drug to reach target cells and also exert their actions. So an example of this would be the target cells have receptor sites. And so with the distribution with the target cells have a special place where the drugs go to allow for a specific action to take place. So these places are known as receptor sites. And this is sometimes referred to as a lock and key mechanism, which describes the interactions of the drug at the receptor site on the target cell. So basically, after a connection is made, the reaction can take place. And in this case, a medication is able to enter into the cell. So you have the receptor key, and then basically the receptor site unlocks, and then the medication is able to go in and then do what it's supposed to do. So now that we've learned about distribution, and this also is a example of the receptor site, which has a receptor key, and then you'll see an example of where it unlocks. Next, we'll talk about metabolization. So metabolization is the actual chemical alteration of the original drug. So when metabolization happens, it's basically breaking down the medicine. So the primary enzyme system is responsible for metabolism, and that's the cytochrome P450. And so the third step in the drug's life is to be metabolized in the liver. And this is an actual chemical alteration of the original drug. So that is why after a medication is absorbed and then distributed, the drug is also going to be metabolized and it's going to break down in the liver. So now that we've gone over an example of metabolization, we're next going to go into the last phase of pharmacokinetics, which is excretion. So excretion is basically the elimination from the body. The drug has already been absorbed, it would have been distributed to the target cell, it would have been metabolized, and then it's going to be excreted. So it has to leave from the body. Now, excretion usually occurs in the kidneys, but excretion can go one or two ways. It can either be through liquid waste or through solid waste. So now that I've given,
I'm sorry to bother you, Ms. Redding. Playera is trying to come in and she can't. She wanted you to invite her in and someone else too. I don't know how to do it. I wish I did.
who is it? Who are you asking me to add, dear? I'm not sure who you're asking me to add.
I got in. I got in. It's Redding. It was Paula.
Okay. It was Playera. I hope I'm saying it right.
Kayla.
No, I got in. I got in. Kayla needs to be added in. This is
Paola.
She
did. Someone added me. Thank you.
Okay. Trying.
All right, can everyone still see my screen?
Yes.
Okay, so continuing, was just completing talking about pharmacokinetics in regards to how a medication goes through the body. And so that's through absorption, distribution, metabolism, and excretion. So And continuing talking about pharmacokinetics for parenteral medications, we'll learn that with the IV route, the medication bypasses the GI system and it goes directly into the bloodstream. So pictured here is an example of how a medicine would go directly into a bloodstream. Now, there are different ways how medications can be injected through the parenteral route, and those routes would include intravenous, intradermal, intramuscular, uh, even subcutaneous, just using some different parenteral routes. So with the intramuscular route, the medication is absorbed through the tissue membrane and then it enters the bloodstream. Now with the oral route, that means by mouth, that must be absorbed in the stomach before it can even reach the bloodstream. So any medicine that's ingested by mouth is going to have to go through the GI process. But the IV route bypasses the GI system, therefore being able to go directly into the bloodstream. So now that I've given some examples as far as the IV route, the intramuscular, and the oral route, we're next going to learn about some special dosing considerations. So it's important to understand the meaning of dose. Dose is the amount of drug that's given at one time. So for example, if a medication is supposed to be prescribed 1 tablet by mouth twice daily, then the dose each time is 1 pill. An example of a parenteral dose would be the amount being given at that one time. So if someone is supposed to be given 10 milliliters of a drug at one time, that is how that could be. Or if they're on an IV and they're supposed to receive 100 milliliters each hour, that could be known as also a dose. Now, the therapeutic effect represents the most effective dose. So with the therapeutic effect, that has to do with the desired amount. So it's the intended effect of a drug. So if too much of a drug is given, that can be fatal or it can be toxic. And if not enough of the drug is given, then it can be ineffective. So I'd like to think of the therapeutic as the intended effect of a drug, and it's also the desired effect. So think of, for an example, if a person had a headache and they took medicine to help alleviate some of that headache pain, and the medicine did exactly what it was supposed to do, then it's reached its therapeutic effect. It did what it's supposed to do. So now that we've gone over some examples in regards to there's some special dosing considerations, the dose has to be considered and the therapeutic effect has to be considered, we're next going to learn about side effects and adverse effects. So the side effects is what happens and is what a patient experiences from using a medication during the clinical trials. So each medicine that is FDA approved goes through clinical trials. And during those clinical trials, patients during the clinical trials are given their feedback of what they experience with a medication. Some common side effects of medications could be drowsiness, nausea, diarrhea, headache, different things like that. So a side effect is what was expressed during the clinical trials from the patients that assisted in those trials. That way, when the medicine comes to market, they can also let the public know based on the trials that were conducted, patients expressed the following side effects. You may have even heard of some side effects if you watched television and seen some of the commercials marketing medications, and you'll hear some of those side effects. Now, adverse effects, those are different. Those are some unexpected complications. A side effect is something that you're going to know that might happen, so that should not catch you off guard. Adverse effect is going to be something that is unexpected, something that negatively happens possibly. If an adverse effect happens, it's often going to require a dose change, or it's going to require for the person to discontinue the medicine, and perhaps they'll be put on something else. A person experiencing an adverse effect might also cause harm to them. So that's why something might be changed or it might be discontinued. So when hearing side effect and adverse effect, you should know there is a difference. Side effect is something that uh, would be expected from the medicine based on the results from the clinical trials, and an adverse effect is going to be something that was unexpected and could lead to a possible dose change or discontinuation. So now that we've learned about side effects and adverse effects, we're next going to learn about contraindications. Now, contraindications should not take certain forms of medications. So a contraindication would be something that's working against something else. You should not take it. So if a person is already taking, say, let's say a pain medication, using this as an example, uh, it might be advised that they not take another medicine that's going to alter the medicine that they're already taking. So some things to consider is when dosing, individual factors must always be considered. So just giving an example in regards to contraindication when it comes to the medicines that's being given. So now that we've talked about contraindications, we're next going to learn about the different disease states or some existing conditions. Now, all of these are the special dosing considerations. What should be considered when a prescriber is prescribing a medicine, the side effects, the adverse effects of a medicine. Also, if they're already on a medication, there might be some other medications that might not work well with the medication that's newly prescribed, the disease states of patients or some existing conditions. So some of those examples would be liver impairment. So there are some drugs that might not metabolize properly. So if it's something, if a person already has liver issues and the drug is already going to be something that might not metabolize proper, the drugs may not metabolize properly if the person has some issues with their liver. Because remember, that's where medicines metabolize. So perhaps instead of them taking something by mouth, they might bypass the GI system and something might be given parenterally. People who have cardiovascular problems, there are different things where people have issues with blood pressure, or maybe they have AFib. So the blood supply may even be less than normal for distribution. So these are things to consider. A person whose kidneys are failing, the drugs will not be removed from the body at the correct rate. So whatever medication is being prescribed, a smaller dose might be required. So these are just some examples of some special dosing considerations. Other considerations when we get into age meaning the neonates or the infants. These could be low weight causes the dose reduction. The neonate has a smaller skeletal structure that can affect the absorption, and there's a limited physical activity that causes decreased blood flow and slower absorption. So if you're thinking what's the difference between a baby and an infant, neonates are usually considered anywhere from 0 to 1 month, and then anything from that would be infant, and then it goes further on into toddler and then other pediatric. So with pediatric, some special dosing considerations to be mindful of is the patient's blood, because their brain barrier might not mature. Now, if the drug is a lipid soluble, which is being administered, it might decrease the distribution. And so the more medication might stay in the blood, and this could cause higher drug blood levels. So it's always important when dealing with pediatrics that everything, especially when it's parenteral, is always double check, or like I like to say, triple check, to make sure that it's the correct thing that's being distributed. So as we completed talking about some examples of pediatric for special dosing considerations, we'll continue to learn that the plasma protein is also lower in the pediatric population. This allows for more drug to remain unbound in the body, and it may also have a greater intensity of the drug effect. Now, in the pediatric population, their liver and their kidneys are not fully developed, and this can cause metabolism and excretion to slow down. The drug also stays in the pediatric body longer, and this could also cause a buildup of drug and fatal toxicity. So it's always super important to pay very close attention to that. So now that we talked about the special dosing considerations for pediatrics and neonates and infants, we're next going to learn about the special dosing considerations for geriatric. So geriatric would be elderly, anything that's usually 65 and older. So things to consider when dealing with medications for the geriatric population is that their cardiac output decreases with age. Cardiac means pertaining to the heart. So because the cardiac output decreases with age, there can be some major effects, such as the amount of blood. This affects the amount of blood, kidneys, and the liver that they receive. The metabolism and the excretion are slower, and then the causes of the side effects could also be worse in the geriatric population. So in regards to the special dosing considerations for the geriatric population, it's important to determine the best drug distribution, because a lean body mass or the muscle is decreased, and then also the percentage of body water is also decreased. So based on what the prescriber has, these are things that they are also taking into consideration. So the drug distribution is greatly affected in the aging adult because of the percentage of lean body mass or the muscle, and also the total percentage of the water are lower in the younger adult. So the drug concentrations level in the body are less because there is less water for a drug to be distributed. Now, with the geriatric population, some other special dosing considerations is that the geriatric population generally are more sensitive to medication, and this requires a reduction in a usual adult dose. Also, the same dosage amount may produce greater pharmacological effects. So the dosing is specifically important when prescribers prescribe for the geriatric population. So now that we've talked about the special considerations for dosing in regards to neonates, infants, pediatrics, and geriatrics, we're next going to talk about the drug interactions. So you have different types of drug interactions. You have the drug-drug interaction. This is where some drugs will potentiate the effects of others. So there are some drugs that should not be together. The drugs could also magnify the effect of another given at the same time. Drug-drug interaction may also require a decreased dose of each so that both of them can have the desired therapeutic effect, which is the intended effect. You also have the drug antagonism, and this is where the drug might block another drug, so it negates the action of another drug, in other words. So now that we've talked about drug interactions, let's next talk about drug-food interactions. You have some food that can affect the effectiveness or the safety of a drug. So one example in regards to the drug-food interactions are people who are on anticoagulation, which means blood thinning medications. There are certain medications that should not be taken with that, because it's going to further thin their blood. An example of that would be broccoli, because they both thin the blood, and so together this could cause internal bleeding. So these are some things as far as auxiliary labels that might be placed on a medication so that a patient is aware. So now that we've talked about the drug interactions, we're next going to talk about the body weight and the amount of drug that's required to directly relate the amount of drug that's required is sometimes directly related to the weight of the patient. And so the body weight of the patient determines the concentration of the drug in that patient's body. And this could be for anyone, whether it's pediatric, adult, or geriatric. There are also formulas for body weight. You have body surface area. For pediatrics, there are certain formulas such as Young's rule or Clark's rule. This is where, for Young's rule, is based on the patient's age. For Clark's rule, is based on the patient's weight. So these are things to be mindful of when it comes to body weight. Now, for route of administration, there are some drugs that cannot be given orally, and an example of that would be the reasons why, because stomach acid destroys the effectiveness of the drug. So there might be some injectable medications that might be better. And so for injectable medications, these must be in an aqueous form for injection. They should also be packaged as a solution or a powder. So anything that's packaged as a powder may require a diluent. And so for the injectable medications, those may be transferred to an IV solution container, and they can also be manufactured as ready to use or premix, just as an example. So now that we've gone over the routes of administration and why some of those are used, we're next going to go over some reference and storage information. Now, all drug products have an NDC for identification, NDC standing for National Drug Code. Think of it like the social security number of a medication. So the drug code, the National Drug Code, enables the technician to verify the exact product. You should know the NDC is broken down into three parts. The first part represents the manufacturer. The second part represents the drug in dosage form. And the third set represents the package size. So meaning package size as in 60 tablets, 90 tablets, 100 tablets, 1,000 tablets. So looking at the current picture, we see Biaxin. Biaxin is the brand name. Clarithromycin is the generic. Anytime you see two names on the label and you see the first name in all capital and the second name in lowercase, the lowercase is primarily the generic name. Now, based on this label, the manufacturer is Abbott Laboratories. So Abbott Laboratories is the manufacturer. So any medication that Abbott Laboratories create is always going to start with the 0074 because that represents the manufacturer. The second set represents the drug and the strength. So Biaxin 250 milligrams is going to be 3368 in the middle. There is a such thing as Biaxin 500 milligrams. So that particular middle number would be different. And then the very last set represents the package size. So it's 60 at the end. So this represents is 60 tablets that fits in the bottle. Also on this label, you'll see where an expiration would be, as well as the lot. Now, the lot can go by various names, such as the lot number, the control number, or the batch number. It's important to know that the lot number represents when the medicine, or should I say, the batch that the medicine was created. So if a person was making, say, a batch of cookies and had to make 100 batches all by hand using their kitchen, they might make batch 1, batch 2, batch 3, batch 4, so on and so forth. And if anything were to happen to any of those batches based on that lot number, they would know which batch is affected. The same works for medications. There are some times where medications have to be recalled. Now, when the medications are recalled, there are different types of recalls, but if a medication's batch of medicine needs to be recalled, then they can just recall that particular batch, not the entire, not all of the medicines that was given, or should I say dispensed. So just wanting to give you an example of lot number lot, batch, and control all mean the same thing. Sometimes on a medication label, it might say batch number, but you'll at least know what that represents. Now, the expiration date is something that's created by the manufacturer, and it lets the person know when the medicine expires. So in continuing learning about reference and storage information, you will know that the label of every drug must include the brand and generic drug. The liquid form will have a total volume of the container in concentration. The powder form will have the information required to dilute. So if there was a powdered medication and it needed to be diluted, it would share instructions on the amount that's supposed to be diluted. Now, if it's prescription, it's going to have a RX only label on it. For example, if we go back to the previous, this is a copy of it, but if you ever look at a real bottle that's provided by a manufacturer, you'll see a RX only label on front of it. Also on the label, it must include the name and address of the manufacturer. It must also have some precautions. It must also have the possible side effects and adverse effects of the medicine, and storage requirements must also be on the label. That way, the pharmacy department will know how the medication should be stored. Now, there are some common references that can be sourced. Some examples of common reference sources include the drug facts and comparisons, the physician's desk reference, as well as the handbook on injectable drugs. These are all sources that can be even found online or also inside of our classroom. So now that I've gone over the reference sources, it's important that pharmacy technicians be familiar with the content of references. That way you know how to verify information about medications and can get familiar with that. Now, there are continuing education lessons, and there are different companies that offer continuing educations. Two in particular include Drug Topics and Pharmacy Times. As an assignment later on in this module, I will have everyone go online to Pharmacy Times website as well as to Drug Topics and get familiar with the continuing education lessons that they offer. And so this is going to conclude chapter 3 as you learned about medications that's used in the intravenous preparations.